Thanks, Marcia. And thanks to everyone here for having me. I'm Nicole Macri, and I represent the 43rd Legislative District, the amazing, beautiful 43rd Legislative District that we're in right now. And it's a great honor to do that and to be here. And it is a great honor to follow Representative Appleton in her comments and in her work that she's done for many, many years. For a long time, single-payer health care was thought of as a real kind of radical, liberal idea, and things are changing about that. I'm really grateful to Sherry for paving the way when courage was really needed to stand firm in the legislature on this idea. And I think we have come to a point where now we are really able to capitalize on momentum that has been building. And so I'm going to talk a little bit about that. But first I want to give you a little bit of background about myself for those of you who don't know me. I was elected for the first time in 2016 and really have spent my adult life working on issues related to supporting people who've been completely disenfranchised from basic quality of life. Outside the legislature, I'm the Deputy Director at the Downtown Emergency Service Center. Excuse me?
I'm sorry, she's disrupting me while I'm
okay.
Yeah, there's another chair right over here, ma'am.
Okay. Outside the legislature, I'm the Deputy Director at the Downtown Emergency Service Center, which is a homeless service organization that works on behalf of people living with serious mental illnesses, HIV, substance use disorders, and other disabilities. And through that work, I have really worked to change the narrative about what works to end homelessness for people who have been really disenfranchised. And that work, I'm working on what's known as the Housing First movement that has taken hold not only here in the United States, but around North America and in Europe, is one thing that gives me hope that we can change the narrative about healthcare access. And it also means that I've been spending my whole life really working on issues around healthcare justice and housing justice, particularly people who have been most disenfranchised here in Washington State and around the country. Like you, I believe that healthcare is a basic human right. It's not a privilege, and it's not something that should just be left for those who are fortunate to be able to access it. This has always seemed apparent to me from my earliest days, but my passion to really work on this policy issue has been bolstered because of my professional experience. I have seen firsthand, as I know many of you have, what it looks like to assist people whose whole lives have been harmed because of our fragmented, complex, under-resourced, and inequitable healthcare system. And I've also been bolstered in this work because of my role as an employer. DESC is a relatively large human service organization. We have close to 700 employees. And I have played a pivotal role in making the healthcare decisions and negotiating with our employees through the collective bargaining process on healthcare benefits for employees. And I have seen year after year how it gets more difficult as an employer to be able to afford high quality health benefits. I'm proud of the work that we have done with workers at DESC to maintain, I think, one of the highest quality health benefits in the state of Washington, really. No premium, low deductible, low copay plan accessible to all employees. But it's come at a cost. It's come at a cost at the bargaining table. It's come at a cost to wages for some of the hardest working people in our city. And I think we can change that narrative. And like all of you, I have seen the impacts of fragmented, complex, administratively complex, and often inadequate health coverage as it's impacted my own family and my friends. My sister-in-law 10 years ago was diagnosed with what was a life-ending brain tumor, and our family walked through the process of ensuring care for her, and I got a really close look at how the healthcare system is not set up to support people and families going through some of the most traumatic experiences that they'll ever experience. So that's what brings me to this work. I want to talk a little bit about where we are now and where I think we're going. In 2018, we actually had quite a lot of success in expanding health coverage for Washingtonians and for protecting coverage. You know, in 2017 and 2018, we were facing a new onslaught of attacks from Republicans in the White House and in Congress to try to decimate the progress that we had seen through the Affordable Care Act. And in Washington State, we decided we're going to draw a line on those attacks and ensure that we can protect Washingtonians. And we did that by ensuring that preventative services will be protected in Washington State, regardless of what happens at the federal level with the Affordable Care Act. Oh yeah, it's a big deal. We finally passed the Reproductive Health Parity Act to make sure that regardless of what kind of insurance that you can have full access to reproductive health care, ensuring critical access, particularly for women. We expanded state-supported health coverage to low-income residents of Washington who come from what's known as the Compact of Free Association nations of the Pacific Islands, who once got federally supported health coverage, which was rolled back in the mid-90s through the welfare reform policies that were made then. So we ensured some of the most vulnerable immigrant communities here in Washington State would get coverage. And we made new investments, as you heard, in behavioral health to make sure that people can get care close to home. And we worked to stabilize the individual market by making sure that we were leveraging the buying power that the state has to make sure that insurers who wanted the state's business to provide coverage for public employees and retirees also had to offer individual market plans across the state. Most importantly to me, we made great strides in the conversation about single-payer health coverage in the state of Washington by, for the first time ever, or in a really long time, having hearings both in the House and the Senate simultaneously in the same session about the Washington Health Security Trust Act, by engaging with lawmakers in that, by putting in the budget a robust investment to examine universal health coverage models, including single-payer models around the country and around the world that will help build momentum and build the information we need to really enact this in Washington State. So those are important ways we laid the groundwork, and it's going to take a lot of effort to continue the momentum. And as Marcia said, we are working on a new strategy that is intended to build on the conversations that are happening currently in Olympia and to push forward a bolder agenda that asks lawmakers to stand in their values. We know in the 2018 elections that healthcare was the issue at the ballot for voters, not only here in Washington State, but across the country. We saw a dramatic change in Congress as a result of people's strong belief that healthcare should be a human right. And we saw those same results here in Washington State. See, I'm going on too long here. And so what we know is that we need to engage folks in that conversation. Right now, we're working on a policy that leverages the conversation around establishing a true public option in Washington State for health coverage. And by saying does not go far enough, that we need to make sure that those who are currently unable to get health care and those who are most vulnerable in the health care that they have need to have support from the state to ensure that they can get high quality, affordable health care when they need it. I know I hear all the time from constituents who tell me that they have health insurance, but they can't afford to go to the doctor because their deductibles are too high and they are afraid of financial ruin if they do go get the care that they need. So we need to support those who currently are most vulnerable. We need to build coalitions with those who have the interest in doing this. That includes our brothers and sisters in the labor movement, includes immigrant rights groups, it includes those fighting for racial justice, it includes those fighting against poverty. And by building those coalitions, we can bring people to the table to talk about what's next. Public option, great step. Providing subsidies in the form of cost-sharing support that goes further than the federal government, or premium assistance that goes further than the ACA, that ensures we cover people who are ineligible for federal coverage. All of that is great, but how are we truly transforming the system, and how are we engaging in the conversation about what it's really going to take? And that's the policy that we are working on. We're working to push our lawmakers to stand in their values and to not shy away from things that are difficult, but to take the bold steps that we know Washingtonians want, because they showed that to us at the ballot. So in order to make that work, we're going to have to bring the full force of advocacy to Olympia this session. And we're going to have to do what we always do, which is to tell the personal stories about why we are all personally committed to this. The stories of harm that we have seen in our own families and in our own communities, and the stories of joy that we know when people get the care that they need, that is affordable and accessible at the time that they need it. And so I am really looking forward to working with all of you to make sure that we can be relevant to the current conversation, that we can build a broad and inclusive coalition of support from stakeholders who are also committed to universal health care, and that we can demonstrate that high quality, affordable, publicly financed healthcare can be the future here in Washington State. So I look forward to working with you all.